It doesn't depend on your certificate. It doesn't matter if you are a plastic surgeon or if you are an ENT surgeon, also a max-fac surgeon. You have to focus on that problem. And best is you do nothing else than rhinoplasty. I, for myself, nowadays don't do anything else than rhinoplasties, and only these people have a great experience and can promise their patients a good result or a reliable result.
I don't think that you have to differentiate between different disciplines. There are max-facs performing rhinoplasty, plastic surgeons, otolaryngologists, trained background. All of these surgeons can be very good. The thing which I have learned from traveling across the world to different meetings is it's the dedicated surgeon. You really have to make a main focus on rhinoplasty since it's such a complex procedure. And once you really dedicate yourself and one part of your work field to this, it will be very, very helpful to increase your skill set.
Of course, for me, that's an ENT surgeon. And why? That is because I think a rhinoplasty is not only aesthetic. I think even if you do a purely aesthetic rhinoplasty, you have to have intimate knowledge of the functioning of the nose and the functional aspects of the anatomy of the nose. How do all these structures interplay into providing nasal passage? So if you dissect or weaken or graft or narrow them, how does it translate into nasal passage? If you don't know this very intimately, you might do a great aesthetic job with complications for function. So the one you should have is the one who has the most knowledge about both. And I think that is the ENT doctor.
The surgeon who is best placed is the one able to deal at the same time with functional issues and aesthetical issues. Does not exist the situation where there is one surgeon dealing with the functional part and the other one dealing with the aesthetic part. So we need a complete surgeon understanding everything about the nose. And of course, the difference between surgeon and surgeon depends on his or her ability to make a good analysis, what I call the aesthetic eye, and of course, the manual skills. Being a good rhinoplasty surgeon, it takes time. It takes at least 10 years. And once again, it is a never-ending adventure.